All right, good. We're good to go. Again, welcome everybody. We're here with Multnomah County Chair Deborah Kafori, Public Health Director Rachel Banks, Emergency Management Director Chris Voss, and we have American Sign Language interpreters Jeb Baldridge, who you can see, and Lise Manjan, who is working with him. We're going to go ahead and get started with some very short remarks, and then reporters will have a chance to ask questions. Thank you.
Rachel is muted.
We want to hear from Rachel Banks.
There we go, Rachel.
Go ahead, Rachel.
All right. Thank you, members of the press, for joining. Once again, my name is Rachel Banks. I'm the Public Health Director, and I use the pronouns she, her, hers. And I'm here today to share some updates with you all about the progress we've made on our reopening metrics that were set forth by the governor's office, as well as the metrics that Multnomah County has put forth. So first and foremost, I will say we have hit the 95% of reaching 95% of people within 24 hours. We have hit that metric. We are moving that from yellow to green, and that means that within 24 hours, we are reaching 95% of the positive cases to follow up with them on their contacts and provide medical information and make sure that they have the support that they need to stay home and recover. We have been hiring people. We've increased our workforce to about 48% of the needed 122 contact tracing staff. We have positions posted on our website for epidemiologists, contact tracers, case investigators. We've really started with making sure that we have the medical people in place and that we have the language capacity in place to address all of the cases that we're seeing. We have a testing plan that ensures that testing is available both geographically across the county, including East County, Mid County, and North and Northeast and West, all across the county. And then we also want to make sure that we have testing sites available for Black, Indigenous, and people of color to access testing from places that they trust. So we have that, we're working on that plan in place as well. The additional thing that we have released this week is a BIPOC, Black, Indigenous, and people of color reopening plan and supportive strategies. So along with the governor's metrics, we, for all of those metrics, have added additional supports and strategies for working with our communities of color and ensuring that disparities are not getting worse for them. That plan ranges from prevention to intervention. It includes things like disaggregating data by race and ethnicity, which you can see on our dashboard. It includes things like our additional metric to ensure that hospitalizations are going down for people of color as they are going down for the rest of the community. It includes supportive communication strategies, contact tracing. So for every metric and every area of that, we have released that plan. And I want to say that that plan has been developed in partnership with dozens and hundreds of people, including our culturally specific liaisons that work in our emergency operations centers, through our partners that we work with in providing our safety net services, from coalition partners, from our clients, from communities of color organizations, and just a broad array of people. It's a draft plan. We'll continue to work on that and vet and get information. So with that, I will turn it over to Chris Voss.
Welcome, good afternoon. My name is Chris Voss, and I'm the Director of Emergency Management for Multnomah County. To support the COVID-19 response, we activated our Emergency Operations Center about 120 days ago. We've reassigned hundreds of county employees to assist us with the response. We've opened 4 shelters, 2 hotels, provided over 150,000 meals through county programs and EOC operations. We've also received over 4 million pieces of personal protective equipment and distributed over 80% of that to the community and community organizations. Several weeks ago, we knew PPE supplies were between difficult and impossible to acquire. And so over the last few months, we've taken the 600,000 donated items as well as what we received from the state to help support the community. We've also developed a process to assist organizations that cannot acquire, and we're still providing essential work for our community. Last week, we reported that the state's PPE metrics for reopening under the governor's phase 1 plan for hospitals and first responders was met. But Multnomah County also indicated that we were still in progress on this third metric for organizations we called PPE key constituents. For this metric, we are tracking daily resource requests, 3-day moving averages, weekly reports on business categories, including businesses that focus on people with underlying health conditions, people that are at higher risk, people over 65, communities of color, etc. We wanted to know and understand the PPE limitations because these services are critical to all of us and important for our values. Where we are now, we know that the resources into the county have, the resource requests into the county have decreased. We also know that we have a 30-day supply of most of the requested items, procedural masks, and we also have set aside supplies to deal with outbreaks and other issues if they arise. We are periodically testing the PPE supply chain, and we're finding that it's easier to purchase PPE. The states are also saying the same exact thing, and they're saying that the PPE supply chain is beginning to normalize. Because we have a 30-day supply for our key constituents based on the current request rate, because the number of requests have continued to decrease, and because the PPE supply chain is improving, we're moving the metric for PPE for key constituents to MET or green. With that, I'm going to hand you off to Deborah Kafuri.
Thank you, Chris. Good afternoon. I'm Deborah Kafuri, your Multnomah County Chair. From the very first COVID-19 case in Oregon, my goal has been to keep as many people alive as possible, and together we've done that. By staying home, we've seen hospitalizations go down. The number of deaths are decreasing. So we flattened the curve. And I wish more than anything, I wish that we could declare victory and move on. But without a vaccine, we can't. We can only reopen public life with the right measures in place so people are able to return to work and school, to re-enter shared spaces in shops and restaurants, and gather in safe communities. Our public health and emergency management teams have been working nonstop to ensure these measures are in place, so that we're ready to closely monitor and quickly respond to what happens when we do reopen. And as we've seen across the country and even in our own state, things can turn on a dime once a community opens back up. The state's prerequisites and the county's own thresholds have provided us with pathway to readiness. And you can see from the dashboard that we're very close to meeting the state's criteria. And we've even gone beyond to address Multnomah County's unique circumstances. If we follow these steps that Rachel and Chris have laid out, we believe that Multnomah County will be ready to turn in our application to reopen on June 5th. On June 10th, we'll evaluate any developments in the dashboard, and if all trends continue to be positive, we will, with state approval, move to phase 1 reopening on Friday, June the 12th. I've told the Board of County Commissioners that many people are more than ready to reopen, but COVID is still out there. So it's important that we have all the steps in place to ensure that our community is safe. And with that, we can open it to questions.
Thank you, Chair. If we could ask folks on the phone to either raise their hand, you can chat us, or you can text us at 503-502-2741. If you raise your hand, we'll try to unmute you and allow you to ask your question.
Seeing one chat.
Seeing one chat. We're getting a a question from, Zach Morris at the Northwest Examiner. He's asking what the significance of June 12th is. Why June 12th?
Sure, I'll answer that. We believe that, as you've seen from the dashboard, that we will be ready to apply on the 5th, and we want to go carefully, slowly, and thoughtfully, because we know that once we reopen, we will have additional cases in our community, and we need to be prepared. We need everyone to be prepared. We need to have the same level of certainty that people are feeling in all of our communities, and that includes Black, Indigenous, people of color as well. And there are some areas still that we need to work on, as you can see on the dashboard, but we wanted to give ourselves time so that we can reassess on the 10th, which is the Wednesday, and we update our dashboard every Wednesday.
We have a question from Lachey Wesley is Multnomah County going to require masks or cloth face coverings to be worn in public? If not, why? Many large cities have done this. And for those watching, you can see Dr. Jennifer Vines has joined us. So the question from K2 News, is Multnomah County going to require masks or cloth face coverings to be worn in public? If not, why not? Many large cities have done this.
And I'll take a stab at this, and then our public health team can join in and talk about the public health aspects. I'll just talk about the political side of things. We are in conversation. If you heard our board briefing this afternoon that we just finished, we have interest from the commissioners in looking into such a requirement. I would say that there's different levels of requirements, and a mandate, which would require enforcement and potential police involvement in that, is something that we're definitely not interested in looking at. We are looking at other options. We also are in conversation with community to talk about the implications to any requirements or direction that the county might give to folks, so that we know that we're doing this together as a community. Rachel or Dr. Vines?
Sure, thanks, Chair. Jennifer Vines here, Multnomah County Health Officer. I would say our goal would be to have everyone feel safe wearing a face covering. To the chair's point, it's mostly to protect other people and to keep your droplets to yourself. And I think this is the new social contract. So I think wearing a face covering is the new etiquette to protect others. That said, not absolutely everybody can tolerate a face mask. And so a mandate gets tricky from an enforcement standpoint. And I will just add that it not only protects other people, a well-made face covering actually protects the user a fair amount as well. So we'll be rolling out more information on this. I think from a public health standpoint, as a health officer, I would urge the public to wear a face covering while inside, and if they're outdoors and can't reliably maintain a 6-foot distance from others. And I don't know if Rachel has more to say.
Rachel can't unmute herself.
We may never know if Rachel. Okay. Rachel?
Okay, thank you. Sorry. I would just add, thank you for that, Chair Kafori and Dr. Vines. I would just want to underscore the point around with that recommendation, that strong urging, that we do not want to see enforcement actions taken, nor do we want to see person-to-person enforcement or frankly judgment on why somebody may not be wearing a mask. We acknowledge there are various communities whereby this is not a great option, and that includes folks with disabilities, hard of hearing, and other community members, Black and Brown folks who simply don't feel safe from an enforcement perspective. So just underscore, we're asking people to do that if they feel safe and comfortable doing that, but do not want the public to be enforcing or interacting with other people if they're not wearing their masks or face coverings, excuse me.
Thanks. We have another question here. Mira Powell from Oregon Public Broadcasting. OHA has reported today that there's an outbreak related to a business operating in the Tri-County area and the Willamette Valley. Can you tell us what type of business that is or the industry that business is in? Dr. Vines?
Oh, she can't just be on here.
Why is she muted? Why is she muted?
Okay, I think I'm off mute, thank you. Yes, so Oregon Health Authority did put out a couple sentences about an outbreak in the Tri-County and Willamette Valley area. They are the lead on this outbreak and have promised more details in the coming days. I can share that Multnomah County has 41 confirmed cases, many of those part of this outbreak, and we are working closely together as a public health system. I'll add that as we increase testing, we will find more cases and we will find outbreaks like this. So I think this underscores the need to be prepared for reopening, to have the testing in place, to have our contact tracing capability online, and to be able to respond quickly to a virus that spreads almost faster than we can keep up with it.
This is a question, thank you, Dr. Vines. This is a question from Ted Seckinger at the Oregonian. If testing sites are the only criteria you don't meet, why not apply sooner, assuming that we can't reopen without all the contact tracers?
Sure, I'll take that one. You know, if it were only as easy as taking a sign from closed to open and then people would suddenly feel comfortable returning to public life, we know that people are not going to return to restaurants and shops if they don't feel confident that public health measures are being taken. So we believe that it's worth it to make sure that we have these measures in place and to give businesses and other entities their time to put the protective measures in place. We've seen what has happened around the country and even around our own state when people have moved quickly to reopen, and the outcomes have not been great. And we don't want to have that same thing happen here in Multnomah County.
Thank you, Chair. Jennifer Dowling from Coin6 is asking, can you describe the metrics that indicate you can reopen? So Jennifer, is that, I assume you mean what's left to do and then what the next steps after the application are?
Rachel, do you want to take that one?
Rachel has to be.
It's weird that she goes right back.
All right, thank you. Yeah, so there's a number of things that we are still working on. One of them is our contact tracing workforce. We've made progress, but we still haven't passed a 50% mark, which I'd like to see at least 50% of folks being in place before we reopen. We just today met the threshold for 95% of the time reaching people within 24 hours. But as Dr. Vines shared, we do anticipate that there will be more cases, and those cases and the spread can move very quickly, and it's hard to catch up after the fact once things have gotten away from us. So we are looking to have at least 50% of that contact tracing workforce hired. That's acknowledging it still, even when someone's hired, we're giving you information about when they're hired. All those people still haven't been trained yet. So it's both the hiring, and I want to lift up that we then have to train people before they're able to get into the workforce. And we also have needed language capacity. So I want to have in place at least all of the languages that we need to address the cases that we're seeing. And we still have some additional languages that need to be hired up.
Thanks. We have a question here from, thank you, Rachel. We have a question here from Pat Doris at KGW. You have all you need to reopen. Why wait 2 weeks? Pat follows that up with, what role does finances play? I understand it was important yesterday to hear how much Portland would share or spend with the county. Can you talk through? So the issue being, of course, if you have all you need to reopen, why wait 2 weeks? Chair, you might have answered that, but if people want to take that a little further, and that he wonders about how the financing, the help from the city or the city's share of the CARES Act money might play into this.
Yeah, I will just reiterate, Pat, that we've talked earlier, we have not yet met all of the metrics, either the metrics that the state has set out for reopening, nor the metrics that Multnomah County has added to ensure that all of our community members are as safe and as protected as possible. So until that time comes, we are not advocating for reopening. We felt it was important to set a date so that people can start to prepare, because we do believe that we will be ready by the 5th to apply, and then by the 12th to reopen. Added to that, we will be taking another look on Wednesday the 10th as we update our dashboard to see if there has been any backsliding or if there's any areas of concern that we want to reassess.
I think, Chair, he wanted to just he wanted to just clarify that he definitely would like to know sort of how the city's, the finances and that shared money comes into it.
I was getting there. Sorry, I was taking a little long, but I'm gonna get there.
Sorry.
No, that's okay. We all know that this format is awkward, to say the least, but we're staying safe by staying physically distant. So yes, it's been no secret that finances are an issue, and I know that people want to know how much this plan is going to cost. We will be going into deeper detail on that tomorrow during our budget conversation, but we've identified between $75 and $90 million for our plan to get through the fiscal year 2021, which starts in July. It's also been no secret that while Multnomah County has 20% of the population and 40% of the deaths and 100% of the public health responsibility, we received only 2% of the CARES Act from the federal government. So we are in conversations with the city of Portland, we are in conversations with the state of Oregon, and we're also putting pressure on our federal delegation, because we know we cannot do this alone. We need their help. And I have had good indication that folks are supportive. I don't have any indication that they're going to turn their backs on the residents of Multnomah County, but there's still there's still more work to be done.
Thank you, Chair. Rachel Monahan at Willamette Week is asking, can you explain why you feel safe opening the county, given that the state's monitoring criteria show that more than half the cases in Multnomah County cannot be traced to an existing case? Why are you comfortable opening the county, given that there are even more cases announced today than ever before? And I unmuted Jen Vines.
Okay, Jennifer Vines here, Multnomah County Health Officer, off mute. That is a very nuanced question. I think we will, like I said before, we will see cases increase. I think what we're trying to avoid going forward is hospitalizations and deaths, and trying to balance that goal with the need for people to return to work, to return to their livelihoods, and to be able to participate in something resembling life. So why do we feel comfortable? I would say we're not open yet. I think our chair has taken an appropriately cautious approach, again with a reevaluation before we hit the final green light. I think we'll have to see where we are. And I think the notion of cases that can't be traced to a source is an important one that tells us how many potential cases or clusters of cases that we may have in our county. So that is something we will be watching. Similarly, you may see case counts go up, but those may all be tied to a known outbreak. So again, Rachel Banks, all of us in public health will be watching the data carefully, looking at the indicators for what this virus is doing in our county, and how we can respond with the public health tools that we have without going backwards. And I think that's been the goal of our careful planning.
We have a question here from another one from Ted Seconder. I'm trying to give everybody one question and then go back through your second one. Ted had a second question about whether the county could provide additional, any of you, Chair Kafori, could you provide additional information on costs and the county's budget for this?
Sure, and I've given a kind of a ballpark figure. I don't have the specifics right in front of me at this point. We will be going into further detail, a lot of detail tomorrow morning, both on the costs, on our projected sources of revenue, and then our hopes and dreams tomorrow morning, 10:15.
Thank you, Chair. Zach Morris from the Northwest Examiner has another question. What would the county's response be if the Oregon Supreme Court strikes down Governor Brown's emergency order?
Wow, that would cause a lot of confusion, I think, among the public, and folks are already, there's already a lot of fear and uncertainty in our community. So I don't have an answer to that at this point, except to say that we are evaluating it.
Thanks. We have another question from Rachel Monahan to everyone from Willamette Week. What are we trying to achieve before we reopen? Is it preventing hospital systems from being overwhelmed or something else?
Yeah, so this is Jennifer Vines again, Multnomah County Health Officer. Fundamentally, it's preventing hospital overwhelm, and it's preventing deaths. So we know that this virus affects people in a range of ways, some people with mild or no symptoms, and some people with severe illness and even death. We know that risk increases with age, it increases with underlying conditions, but no age group is completely safe from the serious complications of this virus. So in reopening, again, we're trying to balance the need for people to go back about their lives in some way with keeping this virus contained enough that it doesn't make its way into a person who's likely to have a more severe illness or end up in the hospital. And similarly, so that we don't end up with a wave of illness where the virus spreads exponentially and ends up in a health system overwhelm like we've seen play out in other areas. So we all have a role to play now and ongoing. And for individuals, that's staying home if you're sick. If you're out, it's wearing a face covering. It's deciding for yourself what level of risk you think is okay for you based on your circumstances and your needs. For employers, it's going to be protecting their workers and their clients. And then we as public health will be tracking test results, we'll be tracking disease patterns, and we'll be doing what we're gearing up to do with our workforce of contact tracers to try to get people who have the virus and those who are at risk of having the virus to make sure they stay away from other people. So this is really going to take all of us working together, I think, to continue to prevent the kind of health system overwhelm and deaths that unfortunately we have seen play out elsewhere that did not have the luxury of time that we bought by the stay-at-home Save Lives order.
Thank you, Doctor. We have a question from Jonathan Bach at the Portland Business Journal. Chair Kafori said in mid-May it was unrealistic to expect a reopening soon. Multnomah County has also held out as other counties push to reopen. What role has political pressure played in Multnomah County's reopening plans?
I'm sorry, I'm not 100% sure your question. Are you saying that our reopening plans?
The question is, what role has political pressure played in getting to this day in our reopening plan?
I don't believe that there's been political pressure that has played a role in our reopening plans. I think we've been guided by our amazing public health team. We've worked very closely with community for all across the county. And really, we've tried to walk the fine line and weigh the importance of our public health, not just from a physical health perspective, but also from a mental health perspective and an economic perspective. Families who can't go to work and earn money to keep food on the table for their children, that's stress that affects your physical and your mental health as well. So I think we've tried to really balance the needs of folks in our community to stay safe and be safe in all aspects of their lives. I don't think that we're going too quickly. I hope we're not going too quickly, but I also don't think that we're going too slowly. I think we've really tried to walk a fine line, and we will continue to evaluate as we go along. We watch the data very carefully. We meet with community members from all walks of life on a regular basis. So we're all, as we've said since the beginning of this, we're all in this together, and it makes sense that we are all working in tandem and working cooperatively.
I am going to follow that up with a second question from Jonathan, which he had asked first, actually. Under what circumstances would Multnomah County close again? And raise your hand if you need to be unmuted.
Since we're following our health experts, I'll turn to them to give us some guidance.
Okay, so thank you for your patience with our muting and unmuting. I think there's a couple of things, and this is to Dr. Vine's point, and then I'll see Dr. Vines if you would want to add anything. We are looking, and we're carefully want to look about hospitalizations and deaths. I mean, clearly if our hospital system was overwhelmed, that would be a red flag for us. We're also looking at making sure that the communities of color and other vulnerable populations have access to the supports that they need. And so, that's part of why our reopening plan is wanting to make sure that we have those interventions in place now. I think something we'd be watching for is if we were unable to we got to a place where we're unable to do the contact tracing, the hospitalizations were increasing, the healthcare capacity wasn't adequate. Those are some of the things that we would be looking for.
Thanks, Rachel. I was hoping you would speak up. Jennifer Vines here, Multnomah County Health Officer. I don't have any hard and fast thresholds for when I might go to Chair Kafoury and say we should reconsider closing. I do think of a safe reopening as sort of a three-legged tool and stool rather, and that depends on the what the disease patterns are doing in our community. Again, knowing that cases are almost certainly going to go up, but really watching for hospitalizations and deaths. The three legs of the stool are personal protective equipment supply, health system capacity, and then the ability of public health to keep up with viral spread through contact tracing, and for us to feel confident that our public health tools are working to contain the virus. So I would say if, I think if two out of those three are sending up red flags, I think we'd be looking very carefully. I mean, we'd be looking carefully if even one of those was sending up a red flag in terms of the data that we'll be watching and tracking very closely in the weeks and months to come.
Thank you, Dr. Vines. Lachey Wesley has a follow-up from K2, a clarification. Are public health investigators still finding evidence of community spread, such as cases that cannot be traced back to a known source?
Mm-hmm.
So just hang on, we've got, there we go. Rachel, you're on. So
I'd actually, I'd want to go back and maybe Dr. Vines, you have a current snapshot from today. I would want to go back and check with the communicable disease team here before speaking, but I definitely think we're seeing cases from a range of places. Dr. Vines, would you add anything?
No, you're exactly right, Rachel. The state publishes a dashboard of percentage of cases that are not linked to a known outbreak, and I believe Multnomah County certainly has a number that are not linked to a known outbreak. So I couldn't tell you the specifics, but it's certainly true that we are finding what we would call sporadic cases, which is cases that are popping up from unknown or from with no known links to an established outbreak or an established case.
Thank you. Zane Sparling from the Portland Tribune is directing this to Chair Kafoury. Chair, is there anything you're looking forward to once the area begins to reopen?
Well, since I really don't leave my house except to come to the office on occasion, what am I looking forward to? I would hope that while I don't want people to rush out and resume business as usual, because we still need to follow the certain physical distancing guidelines, face coverings, hand washing that we've been talking about for several months now. I would love to see people's peace of mind while they are adhering to the public health guidelines. They are also feeling a little sense of relief that we're not forcing people to stay in their homes under lockdown.
Thank you, Chair. It looks like we have, we're pretty close to a final question from Jennifer Dowling, and I think we'll probably have time for one more after this. Jennifer from Coin 6 is asking, since the state says we are seeing 71 new confirmed cases reported, is Multnomah County's new cluster at the Tri-County business contributing to this number?
Yeah, so Jennifer Vines from Multnomah County Health Officer. Yes, a number of those cases are from Multnomah County. Again, the state is the lead and has promised details in the coming days, because this is a more regional situation that they referenced the Tri-County area and the Willamette Valley. So more to come from Oregon Health Authority in the coming days.
Thank you, Dr. Vines. I think we have one more question, which will be our final one of the day. You can always email us additional questions and we'll try to get back to you. Zach Morris is asking, if things go well, fingers crossed, does the county have to wait 3 weeks to apply for phase 2 once we move into phase 1?
My fingers are crossed. And yes, we do need to wait 3 weeks. At least before we move into phase 2. And I will let one of the public health officials talk about why the 3-week time period is so important.
Sure. So this is Jennifer Vines. We really felt like we need to wait a minimum of 3 weeks. That allows enough time for people to decide to mix, for the virus to potentially spread, for it to potentially make some people ill, bring them to testing, get the test results of public health. And so all of that has to play out as people mix.